Hey folks, Dr. Joe Esposito here. I am so happy that you're here. I'm really glad you're here. Last week we did a show, and if you caught it, which I'm sure you did, because I'm sure everyone in the country heard it, we did a show on what causes your pain. And I know you've listened to the shows before. If you have, I talk a lot about nutrition and brain function and muscle function. But we're a team of chiropractors and medical doctors, and we work together to try to get people well. And one of the things we're really good at is pain management. And we try to treat the cause of the pain, not just the symptoms. Now, if I have a headache, I understand, listen, I may want to take some acetaminophen, and that's going to help my pain. But then I want to find out, why do I have this headache? Sometimes it's caused by food. Sometimes it's caused by dehydration. Most likely it's caused by bones out of place pinching nerves. So if you have a pinched nerve, the best thing we can do, of course, is unpinch the nerve, put the bones that are out of place back in place. So in our offices, we check the structure of the body. We check the chemistry of the body. Is there any food that you're eating or something that you're doing that might be triggering the pain? But there's a bunch of other things that we analyze, and this just comes with experience. When I first got in practice, of course, many, many years ago, my first patient, what was his Bill? I can't remember his last name now. I was a good doctor. I went through my education. I think I graduated third in my class, so I knew what I was talking about. But after 36 years of doing this, a lot of things you learn just from experience. So we talked about a lot of things that you may be doing last week that's causing your pain. We're going to continue on that today. And the only reason we're going to do that is we have so much to cover. And everything we're going to talk about today, you have control over. These are things that you're doing every single day that could be increasing your pain. And usually what happens is when we sit down with our patients and through experience, we say, hey, you know what, Garrett, take that big wallet out of your back pocket. Because every time you sit, you're pushing on your hip. And Garrett takes the wallet out of his pocket, and he thinks we're the coolest people in the world, and that we're just so smart. Well, yeah, it might be that. But a lot of it has to do with, we've seen between all my doctors tens of thousands of patients. And so we can analyze things that many other doctors may not even think to catch, much less tell you what to do. So there are things that you can do every single day to help reduce your pain level. And we talked last week about food. We talked last week about wallets. So we're going to cover a lot more things that may be happening in your life that's causing pain. One of the things, I'm not sure if I covered it last week or not, is smells, certain odors. So if you wear perfume, colognes, hairspray, I see these commercials all the time for air fresheners, things you could spray on your clothes to make them smell nice in your car. These chemicals, many times, are extremely dangerous. Some of them are carcinogenic. Some of them are endocrine disruptors. They actually mess with your hormones. So if you're using cologne, for example, it may have something called parfum in it, P-A-R-F-U-M. Parfums can act like estrogen. And when they get into the body, they stimulate the estrogen receptor sites and make your body think it has a lot more estrogen. Now, estrogen is a growth hormone. So too much estrogen can be bad. And in fact, certain cancers can actually be sensitive to too much estrogen and actually grow. So you want to be careful with simple things like perfumes. There's things like phthalates that you'll see in a lot of ingredients, P-T-H-L-A-T-E-S. Phthalates are chemicals that are dangerous to the body as well. Some of the chemicals can actually trigger things like headaches. I was at the studio last week, and I was talking to John, one of my coworkers. He's the guy who does our screening on one of our shows we do on Sunday nights. And he says, got a question for you. And I said, what's that, John? And he said he does other work on the side, and he works on bathtubs. And he fixes cracked bathtubs. And he says, so the resins and the chemicals that we use, are they bad for you? And I said, absolutely, positively, yes. Because one of the things, of course, can trigger headaches, which is real common, but they can also be carcinogenic. I said, so what I suggest, John, is you get those real serious masks, like, breathe with filters on them, not just a basic mask like used for COVID, serious painter's mask, because those chemicals can be very toxic. And he said, oh, thank you. I appreciate that. Now, it's funny, when I'm in the studio, not a day goes by, I don't think, that somebody at the studio is going to stop me. Hey, Dr. Joe, I got a question for you. And it's always about health, which is great. I love that. And I remember when I first started in radio years and years ago, it was a fellow named Clark Howard. You may know that name. Clark and I were sitting there chatting. And he said, Joe, you got to realize something. And his producer was there, Christine. He says, the listeners know you. We don't know them, but they know us. And so they feel very comfortable around us. He says, when the people are comfortable to come up and talk to you, that means you're doing a good job. And I said, that's great. And so I was also warned, too, that as career goes on, people will stop you and it may become annoying. And they said, when it comes annoying, you just have to tell people, not now. but so far it's never been annoying. I love questions from you guys because every time I answer a question, it's not just you who has a health issue, it's everybody listening or a lot of people listening have the same issues that you do. So you may be thinking, Dr. Joe, why can't I get rid of these headaches? Why is it that I'm tired all the time? Why is it that I can't lose weight? It could be that you're putting chemicals in your body totally innocently that are having an adverse effect on your health. Like too much estrogen causes you to lay down fat. Fat produces estrogen, which causes you to lay down fat. So you kind of get stuck in this cycle. I always quote Elvis Presley there, I'm caught in a trap. And you are. Fat produces estrogen, estrogen produces fat. So that's why for women it's harder to lose weight than men because women are more estrogen dominant. Men are more testosterone dominant, so it's a little easier for us to lose weight. But women will say, Dr. Joe, I can't lose weight. Then what else? Well, then you're getting older, of course, and you get belly fat, you're drinking alcohol. So there's a lot of things that can cause that belly fat to occur, but a lot of it is just that you're getting old. Well, your metabolism's slowing down. What do we do about it? That's a whole nother show. Keep listening. We'll talk about that weight loss. I digress here. So certain things, like if you want to wear perfume that has a scent, I wish you wouldn't because I don't like the smells and I don't like touching people when I have to adjust them with perfumes on. But you might want to try something like essential oils. Make sure they're pure organic essential oils, and that might be a better choice. My favorite is rose, by the way, and I just like the smell of rose. And a funny story, years ago I was taking ballroom dancing lessons. And there was a woman there on Tuesday night was open dance. Like it was a dance. You could go there and dance with other people. And there was a woman there, and she must have been well into her 80s, maybe her 90s. And she dressed to the nines. She was just immaculately dressed, perfect makeup, and she was a great dancer. And if I had the opportunity to dance with her, she wore this perfume that smelled like roses. And I said to her, I said, you always smell so good. I said, what are you wearing? And she looked at me, she said, that young man is Tea Rose. And I looked for it, and it's this cheap perfume. Of course, it wasn't healthy for you. I didn't realize it at the time. This is many years ago. And I couldn't even find it anywhere. But it was just a nice scent. So now you can do things like essential oils that'll give you that rose smell or whatever smell you want. But less smells, the better. So what you can do is try to identify certain smells that might be triggering your pain. Gosh, Dr. Joe, I get such bad headaches on Tuesdays. Well, Tuesdays is meeting day or whatever, and you wear perfume. Just stop doing it. Stop doing it anyway, because you shouldn't be doing it for many reasons. But certain smells can actually trigger pain. And so when patients come in our office, sometimes I got to be blunt with them and say, listen, Garrett, that deodorant you're wearing, I understand it's covering up the stink, but the scent, you have to get rid of the scent. So just some thoughts. Sleep is a big issue when it comes to pain, because the body heals when it's resting. And if you're not sleeping, chances are you're not going to get the results that you want. Now, here's the catch-22. You're in pain, so you can't sleep. And so what do we do about that? If you wake up most mornings, take a good look at your sleep posture. How did you wake up? Did you wake up with your head twisted all the way around and your legs curled up around your head? Or think about what you're doing, and then there's certain things that we can do in our office. We teach you how to have better sleep habits. Now, I do end up on my stomach sometimes, and I know that if I end up on my stomach with my head turned to my right, I'm going to have a headache. Turn to my left, I don't. So I work really hard not to have that position. Now, sometimes you can't help it because you're sleeping. But we have special pillows in our office, and they're called cervical pillows. And they have like a little curve in them. And so when you lay on your back, it actually puts your head into an arch, and the neck is supposed to have a curve. Your neck with an arch is 16 times stronger than a neck without an arch. And the reason is arches are stronger than straight lines. So in our clinics, we're always looking at structure. What's out of line? What's out of whack that may be causing a problem? So if we take an x-ray of a patient, we want to see a nice smooth arch in the body, probably about a 30-degree arch. If there's not an arch present, now there's a problem because your head weighs about 10 pounds, and that's the size of a bowling ball. So if you've ever been bowling, imagine trying to hold a 10-pound bowling ball head up on your neck that's really only as big as your index finger. I mean, think about how long your neck is. It's only about the size of your index finger, maybe a little longer. So if you have an arch, you have flexibility and mobility and strength. If you lose the arch, now you don't have that structure holding up this 10-pound bowling ball size head, so the weight of the head is pounding down on the spine, and eventually, inevitably, the spine will wear out. You will develop arthritis. Arthritis is the joints wearing out. You will develop osteoarthritis if you don't have a curve in your neck. It's the only guarantee I can ever give a patient. I can never promise if we can help you or can't help you. I don't know that. But I can promise you that if you don't have a curve in your neck, you will develop arthritis. How often do I see people without a curve in their neck? Almost every patient. Very rarely do I see a patient with a normal curve. Now, when they're done with treatment with us, many of them have restored that normal curve through chiropractic care and exercises and pillows. But you have to have that curve in your neck. Because if you look at anything in nature even, or if you look at structures that have been standing for hundreds and maybe thousands of years, they're made with arches, bridges, tunnels, airplanes, ancient Roman buildings. You ever been to Rome? What's still standing? The arches. Everything else has collapsed because the arch distributes weight, and your head weighs 10 pounds. So what can make you lose the curve in your neck? Car accidents. Anybody been in a car accident? Raise your hand. Most people have. And the seatbelt will hold your body in, but nothing's holding your head in. So when you get hit, your head snaps forward and backwards, and you lose the curve in your neck. Traumas, sports injuries, sleeping wrong, having a bad pillow, repetitive use. We call it tech neck now. What's tech neck? You're on your phone. You're looking down all day. You lose the curve in your neck. So these are things that can cause structural issues that can cause pain. And the number one treatment, the easiest treatment you can do, most effective, least expensive treatment for structural issues is chiropractic care. Chiropractic care is the most effective, least expensive treatment for pain, for back pain. Now, we examine our patients. Most of the patients that we see, a major majority, are good patients. They're candidates for our care. Every now and then, we find a patient who's not a candidate for treatment. So what would that look like? We had a patient call me the other day, and she said she got in an accident, she had an MRI, and she had some bleeding in her skull. That's my friend neurosurgeons. I have a couple of neurosurgeons I have on speed dial. You need to go see a neurosurgeon for that. Once it's stable, then you can get chiropractic care. So we can co-manage your cases all the time. But if you have neck pain, back pain, shoulder pain, numbness, tingling, pain shooting down your leg, chances are it's a bone out of place pinching a nerve. And my opinion, you'd be silly not to just get it fixed. Most effective, least expensive treatment. I have many patients come in, they've had the surgeries, and if they've gone to the ultimate extreme, surgery, and it didn't fix the problem. Then they come see us. Now, sometimes you need surgery. Don't get me wrong. Like I said, I have surgeons on speed dial. I'll call them at home and say, listen, I got a case here. You need to check this case out right away. And of course, when I call them, make an appointment right away for me. So most cases respond very well to chiropractic care, not all. But sleeping can actually cause you to have structural issues. It may not happen one night, but over time, it becomes repetitive injury. And if bones are out of place, they will wear out. You will develop arthritis. If you pinch a nerve, it hurts. Only 10% of the time. 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. So my doctors are trained to not only check the nerves that feel pain, they're also trained to check the nerves that don't feel pain. Because if you come into us, we don't want to get you out of pain. We want to get you well. We want to be your doctors. We want to get the pain under control. We want to get the structural issues under control. We want to get the nerves going to the organs working. We want to get your diet straightened out. We want to fix your digestive system. How many people have digestive issues? Raise your hands. Yeah, gas, bloating, diarrhea, acid reflux, constipation. These are all signs that something's wrong. And that's why we want you to come see us, so hopefully we can get to the cause of the problem, not just treat the symptoms. So if you have pain, if you want to make an appointment, let me give my plug in now. If you want to make an appointment, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. So if you want to make an appointment, go right online, drjoe, drjoe.com. You could book it right online. We accept most insurances, car accidents, sports injuries. Again, if the car was damaged, you were damaged 100% of the time. So if you're in an accident, just come see us. Don't be like so many patients say, why didn't I do this sooner? Oh my gosh, I can't believe I waited so long. First visit is normally $375. We've reduced that to $199 through COVID. We're trying to make it easier for folks. The $199 includes an exam, consultation, x-rays, first adjustment, the next visit going over your x-rays, and a nutrition evaluation. Nutrition evaluation alone is $150. So if you're ready to get well, if you're sick and tired of being sick and tired, just go to website drjoe.com. We'll get you an appointment. So we're talking today about what's causing your pain. Beverages. Of course, what's the one that would cause the most? Alcohol. Red wine, whiskey, beer, champagne, a lot of these can give you headaches. So if you drink and you get a headache, well, chances are there's only one solution to that, and that would be what? Stop drinking, of course. Now, if you're going to drink, and you shouldn't, but if you do, don't. But if you still do, don't. But if you still do, I want you to have 3 glasses of water for every alcoholic drink you have. And the reason is alcohol dehydrates you. Okay, you notice that? You drink one beer, you pee out three. Where those other two beers come from? Your body is flushing the fluid out of your system, and when that happens, your brain can actually shrink. So if you're going to drink 3 glasses of water for every drink that you have, also you want to take Dr. Joe's Super Greens and Dr. Joe's Essential Source and Dr. Joe's B Complex before you go drinking and when you get home. And that's going to solve a lot of those toxic chemical problems that are occurring, including the dehydration. Now, the alcohol is still going to destroy your liver. It's still going to destroy brain cells, but I'm also a realist. Now, I don't drink. I wish you wouldn't drink either. But if you do drink, here's some simple guidelines. And that many times can help a lot of pain. Because I've woken up with a hangover or two in my day, and I remember thinking, why did I do that? That was really stupid. And I stopped drinking because I just didn't like it. So, other things that can cause pain: skipping meals. Skipping meals causes your blood sugar to drop, and in some people, that can cause massive headaches even before you realize you're hungry. And I get that way too. Eat nutritious foods. Don't eat bad foods. Remember, when you're hungry, you're not hungry for food, you're hungry for nutrition. And if you're eating nutritious foods, you're going to solve that problem. If you're eating junk foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, chips, you're depleting your body of nutrients. And what's going to happen is you want to get more hungry. We all do it. You eat something bad, what do you want to do? Eat more bad food. Because your body's saying, Joe, that was a tasty piece of pizza you just had, but I didn't need pizza. I need a B complex. I need enzymes. I need magnesium, selenium, boron. And so your body's saying, I need more. And so the body doesn't know how to tell you to eat an apple, so it just says, I'm hungry. You've got to be smart enough to say, if I'm hungry, I need nutrition. So this is what I want you to do when it comes to food. Every time you eat something, from now till the end of time, I want you to look at it and say, is this going to be good for me, or is this going to be bad for me? Very simple rule. Is this going to be good for me, or is it going to be bad for me? If it's going to be bad for you, don't eat it. How's that for a simple rule? Here's the thing with nutrition. If you're eating well, you'll save so much money because healthy food is so much less expensive than bad food. Now you're thinking, yeah, but Dr. Joe, I can get a bag of chips for $1 at the dollar store and, it's going to be so big. Yeah, but that's not food. That's actually going to cost more in the long run. My German grandfather, I quote him in the second book I wrote, Eating Right for Prescription for Extreme Health. Always buy the best. It's always cheaper. And that's so true. Always buy the best. It's always cheaper, especially when it comes to nutrition, supplements, food. Because a rule that you can do too, if you go to a restaurant, cover up the food, look at the prices. This is a fun little game. Cover up the food, look at the prices. Pick the cheapest thing on the menu, the cheapest entree. Chances are very strong that that's going to be the healthiest thing for you. Steaks are very expensive, $30, $40, $50, $60 for a steak. It's really hard to get to that cost level if you're eating stir-fried veggies. So it's a lot cheaper, a lot better for you, better for the environment. You'll feel better, you'll lose weight, you have more energy, sex life improves. Nothing changes except for the good when you take care of yourself. That's the cool part. And you're going to mess up. I know you are. You're going to go out and have some, scotch and beer and wine and champagne and cheesecake, and you're going to feel terrible the next day. And you're going to say, Dr. Joe was right. I should have listened to him. And that's going to cause a lot of your pain. So in our offices, not only do chiropractic and pain management without a medical doctor, we also do nutrition because we want to get you well as fast as possible. I know it sounds counterproductive for us, right? Why would we want to get a patient out of the office? Well, we have so many patients need our care that we'd love to be your doctor, but we want to try to get you well as fast as possible. So if you skip meals and you notice that, you start getting headaches, just be careful. Lifting, of course, is a big issue, of course, as chiropractors and pain management doctors. People come in all the time and say, what'd you do? Hurt my back. Had a guy come in yesterday, and he was a good example, actually. This guy came to us several years ago, and he did great. Amazing results. Amazing. He couldn't have been happier. But I told him, I remember, I wrote in his notes, I said, you need to finish your treatment plan. Even though you're feeling better, we still need a few more visits just to stabilize the spine. Well, he knew more than me. He was smarter than me. He says, I feel better. Why am I coming here? And I explained to him that 90% of the nerves don't feel pain. You got to fix the structure. And so if you don't have pain, you still may need more visits. He stopped coming in. And I told him, chances are you'll be back. Sure enough, yesterday he came in, no appointment, doubled over in pain. I mean, screaming in pain, actually, just yelping in the office. Got him back in the room. I didn't take my lunch. He came in right at lunch. I let the other doctors have lunch. I stayed. did an exam, did x-rays, compared it to the old x-rays. Sure enough, it's much worse than it was about a year or so ago. And he told me, he says, I remember you told me this was going to happen. I said, I'm not going to lie to you. Of course it's going to happen. He says, I'm really sorry I didn't listen to you. So love to be your doctor. If you have pain, be careful how you lift. If you lift something and it hurts, stop. Pain is a warning sign. Pain is telling you that there's something wrong. And if you ignore it or cover it up, that's not a good idea. So lift properly, of course. Lift with your knees. Don't bend over and try to lift something. And if you're 16, you might be able to get away with it. If you're 30 and above, chances are you're not going to get away with it. If you have pain, that's a warning sign. Don't ignore it. Come see us, and let's get that under control as quickly as possible. Usually, it's a pinched nerve. Sometimes it's a ruptured disc. If it's a ruptured disc, depends how bad the rupture is. There's what's called protruding disc and a prolapse disc. There's two different things. Protruding means the disc is bulging a little bit, putting pressure on a nerve. Prolapse means the disc is actually burst. And so depending where we are, you want to catch it before it bursts. If it bursts, many times that's a surgical case. And most people are not happy with surgery, even though they may get great results. If you fuse one part of the spine, the other parts of the spine now have to move more to make up for that fused area. And many times, if you have one surgery, you're going to need one or two more before you die in the spine. So again, I'm not saying you don't need surgery. I'm saying be careful. If you do have surgery, you probably want to get chiropractic care to stabilize everything around it and just to make sure you're in good shape. Nutritionally, again, we covered a lot of that. The supplements I take, people always ask me this. I get this question every single day. Well, Dr. Joe, I just want to take what you take. What do you take? I take Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are the minimum supplements everybody should be taking. They're 2 powders. I mix them together. They taste great. I take digestive enzymes. Whenever I eat a cooked meal, I take a digestive enzyme, which helps break down the food. I take vitamin D, and I cannot stress enough the importance of vitamin D, especially on the immune system in COVID years. Vitamin D, glutathione is an antioxidant, also good for the immune system. Probiotics. So my protocol for my immune system, Super Greens, Essential Source, vitamin D, probiotics, and glutathione. Then I take a digestive enzyme. I take a B complex. I take omega-3 fatty acids, which are very, very good for the brain function. I take nitric oxide, which opens up my blood vessels and increases circulation throughout my body. The other day, I was going to do a show, and I was tired. I didn't sleep well the night before because I was watching cop dramas, which I usually don't do, actually, and I really got involved in them. So I didn't sleep very well. So the next day, I had to do a radio show. So I usually I took double dose of nitric oxide. I was fine. Energy coming out the ears. I'll be careful here. We're on radio. So I had so much energy, I was fine. So that's what I take every single day. But we customize a plan for all our patients. Everybody might need different things. So the supplements we're talking about, by the way, are on the website, drjoe.com, drjoe.com. Also on the website, we have over 1,500 hours of podcasts. We have audio. We have video. Depends how you like to learn. It's all there, 24 hours a day, no charge. It's all my gift to you. If you have a question, you can always send it through the website, and I'm more than happy to have me, Garrett, or Joe answer it for you. We're really good about trying to get back to you as quickly as possible. We're not always online. So if you send a question, wait a few minutes. Don't say, hello, hello. If we're there, we're going to answer it. If we're not, we will send you an email. That's why it's important to put your email address in there. So the website is there 24 hours a day. You can order supplements. We can deliver them to you, of course, or you can come pick them up. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can come pick up the supplements. Saves you some money. And I'm all about trying to make this as affordable as possible for you to try to get well and stay well. So, folks, if you want to make an appointment, if you have any questions, you want to listen to podcast, drjoe.com. Our podcast, if you use a podcast service, look up Dr. Joe for the health of it. Dr. Joe for the health of it. That's our podcast. I'm Dr. Joe Esposito. Got a lot more to cover. Don't go anywhere. We'll be right back. Hey, folks, Dr. Joe Esposito here. If you stayed with us, thank you for just joining us. Welcome. Glad you could be here. If you're a first-timer, welcome. Glad you could be here. Hopefully somebody told you about the show. You stumbled upon us, and you're saying, oh, my gosh, this is amazing. I've never heard healthcare put in this way. Because what we try to do on this show is we try to make healthcare so easy that you understand it. It's not that you have to be some, a doctor who graduated from some fancy school with all these degrees. Healthcare is what you do every single day. Some of you have health insurance. Many of you don't have a health plan. There's a big difference. You say, well, it's my insurance plan. No, it's your insurance policy. Your plan is what you do every single day to try to get well and stay well. The 3 things you need. normally functioning nervous system, normally functioning digestive system, and good nutrition. That's it. If you have those three things, a lot of your healthcare problems will go away. How do I know this? 36 years of doing this, I'm getting pretty good at it. So today's topic is what's causing my pain. Because we have 4 offices, Marietta, Duluth, Stockbridge, and West Cobb. Every minute of every day, there is somebody, multiple people in our offices in pain. And my doctors are really good at getting people out of pain because I'm one of their patients too. So I know the quality of the doctors that we have. I believe we have some of the finest doctors in the world. That's my opinion. So pain is easy when we diagnose it with you, but I want you to start taking a little control over your own health. So some other things that may be doing it, and we kind of joked earlier about tech neck, but your workstation. That's a new word, by the way. If I had said workstation 20 years ago, that wouldn't have meant anything to anybody. Now everybody has a workstation. We probably have multiple workstations. You have one at home. You have one at the office. You may have more than one at the office. I have several offices around my office where I have to work. We have the studio, of course, where I do my shows. So if you spend many hours a day at your workstation, give it some thought. A poorly positioned chair can cause you slouching forward, straining your neck. Monitors too low or too high. Here's how I want you to be. Sit down in your chair. Put your feet on the ground. Your legs should form a nice little angle, a 45-degree angle, okay? Your arms should be, if you put them at your sides, the arms should go straight out from your elbows, and that's where your keyboard should be. Your computer screen, the top of your computer screen should be even with your forehead. If it's up too high or up too low, you're going to have neck problems. And you want to make sure you're sitting up straight. If you have a chair that leans back, maybe lock it so it doesn't keep leaning back on you. Now, these are really important because we see so many tech neck patients all the time now. And often if you're on your phone, what do? You're looking down. So try to lift your phone up if you can. Don't keep looking down because we talked earlier about curves in the neck. So your workstation is really important, especially if you're spending several hours there a day. Do it right. And if you have a laptop, put it on books. Put it on. You know what a book is? Maybe some of you don't know what that is. It's a thing that has information in it. It's not Google. So you can stack it up on books, and you could get your monitor up that way. And then if it is a laptop, you may want to have an extra keyboard coming off your monitor so your arms are where they need to be. Really important to position yourself. That can cause pain. I get a lot of patients with headaches when they're on their computers because of eye strain. Eye strain can occur if you have your vision not right. I ordered a pair of glasses not long ago, and my vision is getting better, which is really kind of cool. I'm excited about that. And I ordered glasses, and close my right eye, it looked good. Close my left eye, things look blurry. So I went to my eye doctor, and she checked it, and she said, it's not the prescription I gave you. So I called up the company that made the glasses. They said, okay, send them back. I sent the new prescription. They were very accommodating, sent me back new glasses, and as soon as I put them on, my vision was perfect. So really, really, really excited about that. So make sure your glasses are where you should be. Get somebody who has good vision and say, hey, how far away can you see? What do you see over there? Reading a street sign or something. If you need to, go to your eye doctor and get it checked and get the prescription fixed. I don't like wearing contacts because they bother my eyes. I get all dry and they itch and everything like that. So I switched to glasses years ago, and that's where I am. But like I said, the good news is my vision is getting better. If you don't know my story, I have macular degeneration. I was told years ago that I have macular degeneration. It's pretty advanced, and there's not much you can do. Most people go blind from it or certainly lose their vision. It's most of their vision. So I got a real strict regimen of supplements, Super Green, Essential Source, digestive enzymes, nitric oxide. And if you go to the website, drjoe.com, just type in macular degeneration. Garrett was kind enough to take the pictures of my eyes over the years and put it on the website. And you can actually see my macular degeneration improving over the years. It's really pretty cool. So, eye strain is really important that we address it if we have it. But things like nitric oxide can increase circulation. Super Greens and Essential Source give you antioxidants because free radicals are eating away at your eyes, eating away at everything. And antioxidants work real well as well. But there's my story. I'm not saying it's going to work for you, but I am saying it worked really well for me, and I have my eyes there to prove it. Other things that can cause pain. Weather changes. This is something that people, for years, when I first got in practice, it was a hoax, it's not real. But if you have an injury, let's assume you're in a car accident and your head snaps back and forth, you injure your neck, which, by the way, if you're in a car accident, you did injure your neck. There could be some swelling in that joint. Now, as barometric pressure drops, what that means is there's less pressure around you. There are molecules in the air that are pushing down on your body, and your body is pushing out on those molecules. So if you're at sea level in theory, the pressure is balanced. You're pushing out as well as it's pushing in. But if we go through a low pressure system, which means there's less air molecules, usually bad weather because high pressure will push the clouds away. Low pressure, the clouds are able to move in and rain's able to fall. So usually when there's bad weather, you're in a low pressure system. Your joints can actually swell and expand because the pressure out inside your body is less than the pressure pushing in. And as your joints expand, that can cause more pain. And so people can say, I know it's going to rain. My shoulder hurts, my knee hurts, my neck hurts. So many times weather changes can trigger things like headaches or neck pain or knee pain. You can't control the weather, obviously. However, what you can control is the joint. If the bones are out of place, causing the inflammation, what do we want to do? Put the bones back in place. Not hard to figure that one out, was it? So if you put the bones back in place, many times that takes the stress off the capsule, the capsule's the surrounding joint. It's kind of like a encasing around the joint. And if the capsule isn't inflamed, you're going to have less inflammation. And so the barometric pressure changes are going to be substantially less for you. So that's why I strongly advise that if the weather does change, you probably want to come see us. Now, many times I'll have people come in with knee pain, and they'll say, I feel it in my knee or I feel it in my shoulder. Well, that could be due to joint wearing out, causing an inflammatory reaction. Now, if a joint starts to wear out, it's called osteoarthritis. Osteoarthritis is the bones out of place rubbing up against each other. Rheumatoid arthritis is an autoimmune disease. The body is attacking itself. So let's just focus on osteo for now. Osteoarthritis is always due to a bone out of place. So chiropractic is very good at putting those bones back in place, but sometimes the joints are starting to wear out already. We might want to add to that something called PRP. PRP is called platelet-rich plasma. And what we do is we take your blood, we spin it down, and we take out what's called the platelets. The platelets are the growth factors. These are the things that can stimulate new growth. So we can take the platelets and inject it into an arthritic joint, and many times that'll recruit these healing cells that'll start to grow new tissue. Now, it may not grow a whole new joint for you, but in many cases, PRP is the answer when you have arthritis. And we do PRP in our office, our Marietta office specifically. And I had a patient call up the other day, and they asked about price, and I told them, and they said, oh my God, that is so much less expensive than what I've been quoted for things like stem cells or even injections. And I said, well, why don't we set you up a time? And they said, how soon can I be seen? So PRP is really a cool thing because it's your body's own, it's concentrating your body's own healing factors and putting it back into the body. What else can we use PRP for? Hair loss. If you have spotty hair loss, like male pattern baldness, we can take those PRP cells and inject it into your scalp. And that can stimulate new cell growth. We can use it for skin issues. Many times if there's wrinkles, we can go ahead and put it into the skin, and that can act as a non-surgical facial. Erectile dysfunction. You can put it right into the organs and start to stimulate new growth. Women, as they get older, especially if they've had a lot of children, sometimes things don't work like they used to down low. They may cough and sneeze and urinate a little bit. You can use the PRP as well. So if you want more information about all the services we offer, go to our website, drjoe.com. There's a tab in the upper left-hand corner, and it says services. Drop down on that tab, and you'll see all the different services that we offer. And everything, weight loss, supplements, nutrition, pain management, PRP. We really trying to make our office, we have made our office a sort of a one-stop shop when it comes to healthcare. And so we'd love to be your doctors. If you want to make an appointment, you can do it right online, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We accept most insurances, car accidents, sports injuries. Again, if you're ever in a car accident, please, folks, as soon as you're in the accident, get to see us. The faster you get to us, the better results you're going to get, and the less hassle the insurance company is going to give you. Believe me, the insurance companies are nightmares to deal with. So you want to come see us as quickly as you possibly can. And we see patients in all offices. We're even open on Saturdays in our Marietta office, so we can see patients on Saturdays too. So we're talking today about what causes your pain. Some of the basic stuff, of course, if you're a weekend warrior, you want to go out and do a lot of gardening, and I am guilty of that. I'll get out there and start shoveling wood chips because I do a lot of wood chips around my gardens because it prevents weeds from growing, it locks in water, and then the wood chips compost, and it gives you good soil. So I've been accused and known to have done too much work in one day, and I start to have pain. And so if you're a weekend warrior, just be careful. You know, if you know you do something that hurts, stop. Make sure you stay hydrated. That's really important because a lot of times you're out there working out and you're not drinking the fluids. Stay hydrated. That's really important. Chiropractic care, of course, is an absolute no-brainer when it comes to things like that. We have something called a Class 2 laser. It's called an Arconia laser. And an Arconia laser is very good. It's a laser light, and it sends impulses into the cells, into the body, and it stimulates what's called the mitochondria. The mitochondria produce energy, and so the cells start to revitalize themselves. So we do a lot of work with, I guess you'd call it anti-aging medicine, with the PRP shots, the chiropractic care, the laser, the nutrition, the digestive issues, and we want to keep you as young as possible. And I think that's pretty much everybody's goal. But also what happens with the laser, it blocks something called the COX-2 enzymes. COX-2 enzymes, it's a cascade effect that occurs that causes pain. This causes this, causes this, causes pain. It blocks the COX-2 enzyme, one of the things, it's a COX-2 inhibitor, so to speak, and it prevents it from going into that pain level. So it's also good for pain management also. So again, we have a lot of different services that we offer, and it depends what's going to be best for you. But the only way to know that is come see us, and we'll figure out what's going to be best for you. If you have kids and you like to give your kids shoulder rides, I've been guilty of this as well. You throw the kids up on your shoulders, and the kids are little, and it's cute. And then as they get older, they still want to get carried. So this isn't going to affect everyone, of course, listening, but just be careful. You know, if you're lifting up kids, you're lifting up boxes, you're throwing something over your shoulders. If you do it all the time, you're probably in good shape and you're able to manage that. If you don't do it all the time, that can be a big issue. Headaches in the morning. We're talking about what causes your pain. Headaches in the morning, grinding your teeth. Many times you grind your teeth. Now, the question comes up oftentimes, Doc, why do I grind my teeth? When you go to sleep, your body goes into something called sleep paralysis. Your body's muscles are paralyzed, and the reason is, we believe, is that you don't act out your dreams. Because imagine if you acted out your dreams, you'd fall out of bed and hurt yourself and things like that. So your body goes into sleep paralysis, but the masseter and the temporalis muscles, the muscles that grind your jaw, excuse me, don't go into sleep paralysis. So the one muscle that's still working is your jaw. And so many times you're grinding your jaw, and that can tighten up the muscles in your skull, the temporalis, the masseter, the pterygoids, which are inside, and that can cause headaches. So oftentimes when patients come to see us, we'll ask them, do you grind your teeth? Well, I don't know. I have no idea. So we can just get them. You could start out very simple. Get a mouthpiece, like for sports, a sporty mouthpiece. You dip it in hot water. You put it in your mouth. It molds to your mouth. And then after a few nights, look at it and see if it's being eaten away at on the bottom. And chances are then you're grinding your teeth. So what we can do with that, chiropractic is really good for that. You can adjust the upper neck, and that can help. We can actually adjust the muscles and the jaw itself to try to get those muscles to release. So sometimes we got to dig a little deeper than just the neck, and we have to do the jaw as well. Now, sometimes we do have to send you out to a dentist, and they can do a mouth guard, a specific mouth guard specifically for you. But again, the mouth guard is treating the symptom. It's not treating the cause. Did you follow that? So grinding your teeth, what's causing it? Is it stress? Many times it's stress, of course. Then we have to dig a little deeper and say, what is causing the stress? Chemical, physical, or emotional? Those are the three main things you have pain from, or stress. So we talk a lot about pain today. Pain is a stress. And so if you have pain, do everything you can to fix the cause of the pain. That removes that stress off your list of possible stresses. Chemical stress. Eating a bad diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. These sugars and bad foods put a stress on your digestive system. And that can cause a bunch of problems. I'm not going to go into a show on digestion and brain. We've covered that before. And if you want to look up a show, by the way, or a topic, just go to the website, drjoe.com, type in what you're looking for. Chances are we've done a show on it, and you can listen to it there. And again, it's no charge. We have audio and video. So chemical stress, it's not just what you eat, it's what you don't eat. I want you to stay away from the bad foods, the meats, the sugars, the dairies, the coffees, the sodas. These are the foods that are going to put chemical stress in your body. Now, the good part is if you've taken those out of the choices, what's left? Good foods. Good foods like fruits and vegetables, nuts and seeds. If you don't know what to eat, go to our website, drjoe.com, type in, so what can I eat? Hit enter. Have a whole hour. I just went to a studio one day and just recorded it. Breakfast, lunches, dinners, snacks, raising kids, parties, birthdays, Christmas. I covered all so that you know what to eat and what not to eat. So main things you're going to eat are going to be fruits, vegetables, nuts, and seeds. That's pretty simple stuff. So if you don't know what to eat, do that. Supplement-wise, I can't imagine not taking supplements every day. And I can't remember last time it happened. I think I traveled and I ran out maybe. But anyway, you see such a difference when you start taking nutrients into your body that your body needs. So the minimum supplements I recommend are going to be Dr. Joe's Super Greens and Dr. Joe's Essential Source. Those are the two supplements I think everybody should be on. If you're on blood thinners, there's a little disclaimer on the website. It tells you what to do about it. Still take it. It just tells you what to do about it. So Super Greens and Essential Source. Of course, vitamin D. Folks, it's the least expensive insurance policy you'll have, and there are so many studies out with COVID and cold and flu on how normal vitamin D levels reduce your risk of getting sick dramatically. Not just cold and flu, but diseases as well. So I take 5 drops of Dr. Joe's vitamin D every day. I can't imagine you're not. I don't know why you're not. You should be. So those are the minimum. And then I always say if I'm building my immune system, I take glutathione and I take probiotics as well. Super Greens, Essential Source, vitamin D, probiotics, and glutathione. That's my immune protocol. And then I take other supplements as well for other issues too. So yeah, supplements are going to be really important. And when the body's healthy, it's much better, easier to deal with pain. And every single day, patients come in our offices and they say, Dr. Joe or Dr. Irwin or Dr. Amy or Dr. Kat, why didn't I do this sooner? Dr. Martini, why didn't you tell me I should be doing this sooner? Dr. Joe, you should have said, I know, I've been telling you folks. And it's a simple answer. Get the nervous system working, get the digestive system working, get on a good diet. Those 3 things are really easy ways to have a health plan and deal with pain. And that's today's topic. Today is what's causing my pain. So you got to be proactive if you really want to get the results that you want. And proactivity is really easy. It's way less expensive than anything you're even doing right now. So there's no reason not to be doing these things. Nitric oxide opens up the blood vessels, increases circulation, gives you a burst of energy too. How do I get off coffee, Dr. Joe? Dr. Joe's nitric oxide, Dr. Joe's adrenal support, and Dr. Joe's B complex, and of course, Super Greens and Essential Source. If you take that, I can't imagine you wouldn't get a burst of energy. And then if I have a really busy day, or if I have to do a bunch of radio shows or TV shows, or it's crazy with patients, I'll take a double dose of nitric oxide. And it's amazing. I can't take it at night. If I take it at night, I can't sleep. So just be careful with that. Don't take it at night. I had a patient come in the other day, young girl, and she said, I am so mad at you. And she was smiling. And I said, why are you smiling? She goes, well, I'm not really mad at you. She goes, you didn't tell me not to take Super Greens and Essential Source at night. I said, I didn't think I had to. She says, I took it. I cleaned my whole house. She goes, my house is immaculate. I didn't sleep. My house is immaculate. She said, so you should have warned me. And I said, well, I guess I should have. So I'm telling you right now, I like to take my supplements in the morning because it may give you too much energy and you may not be able to sleep, which is great. And again, if you're eating a plant-based diet, a lot of fruits and vegetables, nuts and seeds, chances are you're going to have a lot of energy anyway. And then you add things like B complex or nitric oxide to the mix, adrenal support, Super Greens, Essential Source. You're going to become annoying to your friends. Because I haven't had a cup of coffee. I used to work at a donut shop, D&D. And I used to work there when I was young. I was like 14 years old. And I cleaned toilets. And then eventually I learned how to bake, and I became a baker. It was kind of funny. Here I was 14, 15 years old baking donuts. And I remembered everybody said how good their coffee was. So I had a cup of coffee. I felt awful. And I thought, why do people drink this? It's bitter and it's horrible. And so anyway, I know a lot of you drink coffee. You shouldn't. If you do, make sure it's organic and make sure you're drinking a lot of water because it does dehydrate you. But I never quite understood coffee, especially when you can get a much better rush of energy without the jitteriness and without the effects on your colon and everything else. So kind of good. Run out of time here. Let me cover a few more things. We talked about stress causing pain. Many people tighten their neck muscles. They tighten their jaw muscles when they're under stress. So try to get to the cause of your stress if you can. That's really important. Romance can actually help with pain. So if you have headaches, many times if they respond to medications, that might work. But romance might be something you might want to add to the mix because it can actually help you. Now, sometimes when romance is an issue, if you have romance and you get this shooting pain in your head, that can be very dangerous. Okay, because sometimes the vasodilation occurs, the excitement occurs. You might have actually injured your neck, or you might have ruptured a blood vessel. So if you ever get the worst headache you've ever had with sudden onset, you probably want to get to the emergency room right away. Could even be a stroke. So again, it may not be a chiropractic case, but if it's a slow onset, it's usually a chiropractic case. But again, if it's after a big exertion like that, and also especially if you start to slur your speech, If your mouth starts to droop, you can't hold spit in your mouth, one eye is drooping and one isn't, you can't blink your eyes properly, that could be a sign of a stroke. That is an emergency room case immediately. The quicker you get to somebody when they have a stroke, the better off you're going to be. So when do we want to seek immediate medical attention? Not chiropractic attention, medical attention. Severe chest pain, especially shooting pain down the arm. Now, women have different symptoms for heart attacks than men. We did a show on that a while ago. Just look up heart on the website, drjoe.com. Again, immediate onset of the worst headache you've ever had, get to a medical care right away. You're bleeding, get to a pain right away. You broke a bone, get to medical care right away. If you start losing strength, you can't lift your leg, you lose bowel and bladder control, get emergency room treatment right away. If you have anything but that, chances are you'd be a good chiropractic candidate. So if you do want to make an appointment, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can go right to our website, do it right online for those tech-savvy ones. If you're not tech-savvy, the phone numbers are everywhere all over the website, drjoe.com. Just give us a call. We'll get you set up as soon as possible. We accept most insurances, including Medicare. I know we're one of the few doctors left that take it. Car accidents, if you've ever been in a car accident, please get to us as quickly as possible. You don't want to waste time with car accidents for your health, but also for the logistics of it. Insurance companies will jerk you around many times if you don't go to the doctor right away. And I've had patients say, well, I don't have a car because my car was just damaged. Well, you didn't go to the doctor. I couldn't go to the doctor. Didn't have a car. I mean, it really is. It's like a Abbott and Costello scene sometimes with these insurance companies. But we'd love to have you in as a patient. We can see patients Marietta, Duluth, Stockbridge, and West Cobb for car accidents. We co-manage the case if we have to refer you out. Many times our medical doctor on staff will evaluate the case as well. We do PRP right in the office, so if you have degeneration, again, we went over that before, just go to website drjoe.com, look at the services link, just it's a drop-down, and you can see all the services that we offer. Nutrition evaluations, I know this show goes all over the world. If you can't make it to the Atlanta area, we'd be more than happy to do a phone consultation. We could do telemedicine with you. We're more than happy to do that. We have patients come from all over. One day we had, gosh, who was it from? Nebraska and Michigan and Iowa, something like that. 3 different patients from 3 different states flew in to just see us. And we'd love to help you. We really want to be your doctors. If you want to order the supplements, again, minimum supplements, of course, would be Super Greens, Essential Source, and Vitamin D. We can ship them to you if you'd like, or you can come pick them up, save some shipping. The website has over 1,500 hours of podcasts on it. So you can pretty much find anything you're looking for on the website, drjoe.com. There's very few topics we haven't covered. If you do have a question and you can't find it on the website, a little bot will pop up on the website. It says, would you like to chat? Say yes, and send us your question. If one of us is online, we will answer the question right away. If we're not online, make sure you put your email address in. We will get back to you as quickly as possible. We want to answer any questions you have. We want to make getting well as easy as possible. It's not hard to get well, folks. Normally functioning nervous system, normally functioning digestive system, and good nutrition. Tell your friends about the show. Follow us on social media at Dr. Joe Esposito on Facebook and Instagram. The website, again, drjoe.com. I'm Dr. Joe Esposito. Tell your friends about the show. We'll catch you next time.